Mrs. Lee. How are you doing today?
Good.
Is it okay if your family member is here while I ask you some questions?
Yeah, that's fine.
So, I saw that you rang your call bell. Is there anything going on today that I can help you with?
I'm with a little bit of pain right now.
Okay, how would you describe your pain? Is it dull? Is it stabbing? Is it burning?
It's dull. It's really dull. It's like a 3 right now.
Okay, is it in one specific area?
It's in my shoulder.
In your shoulder? Were you doing any activity today?
No, just sitting there watching shows.
Okay. I'm just going to take your vital signs and listen to your bowel sounds just to make sure that everything's okay.
Okay. So we're just going to take your blood pressure.
Okay, so Miss Lee, I'm looking at your orders and I see that you have ibuprofen 800 milligrams as needed, prescribed by the nurse practitioner. Would you like to take that now?
Yes, please.
Okay, I'm just going to check your wristband. So can you tell me your name and date of birth?
Dolores Lee, December 31st, 1930.
Okay, good. Now I'm just going to scan the medication. And here's your pill. Okay. And now I'm just going to document that you took the medication today. And you can let me know if there's anything else that you need just by ringing the call bell.
Alright,
I think we're
gotcha.
good. Are you feeling any better?
Not really, no.
Wait, what's still bothering you?
It's my shoulder, now it's kind of going to my neck a little bit.
Is it the way you're sitting, or
This is comfortable right now. I was sitting up before. This is comfortable right now as it is.
maybe we can get? Do you think it's bad enough where we should get the nurse, see if she can give you something different?
No, I don't want to bother her. I don't want to bother her again.
But if you're in pain, we need to get you something.
No, I know. I just don't want to bother her right now. You know, I feel bad. She's busy. You know, I don't want to be a pain.
But they're here for you.
I know, but you know, I just want to leave them alone because I don't want to bother them. I don't want to make them mad at me or anything.
They're not gonna be mad at you. If you're in pain, then you need to get something. So I'm just
I'll
gonna.
wait. I'll wait a little bit. I'll just wait. It's okay.
Well, we can just call. She was only here a couple hours ago.
No, it's fine. They're probably busy documenting whatever.
No,
It's
let me
okay.
just. I'm just gonna call. See if I can call the nurse right now.
No, dear, it's okay.
What did you have for breakfast this morning?
Had a cup of coffee. That's really it.
That's not enough.
I know.
You should have ate something, even if you had something small.
I wasn't really hungry.
Yeah, but you cannot eat anything.
Don't argue with me, please. I really don't want to deal with this right now.
Deal with this. You're in pain. You're already dealing with it.
Just whatever. I don't want to do it right
No,
now.
I'm gonna call the nurse. The nurse needs to come in here. I'm gonna go get her.
Excuse me?
Yes.
Sorry to bother you. I just wanted to come talk about my mom because
Sure.
she's in so much pain and she won't say it. She's like sitting there, she's all tense. She didn't eat anything this morning. All she had was coffee. And she really feels like she's bothering you guys and she doesn't want to be a bother. So she's afraid to say that she's in pain, but I can tell by the look on her face that everything's bothering her. I think her whole body's aching, the pain in her shoulders and in her legs still bothering her.
Okay. I'm going to go in and see if I can do anything else for her.
Okay, thank you. Hey, I went and I talked to the nurse. I asked if we can get some more pain medication for you because you're in too much pain.
Why would you do that?
Because you're in pain and you need it.
I don't need it. Look, listen, growing up, I didn't take a lot of pain pills. Why would you go ahead and tell me this now?
I understand that, but you can't sit here in pain all the time. They're going to give you medication. It's going to help you. You're going to feel better.
Oh, she gave me something already. Why would you go ahead and bother her?
Because you
Seriously.
still have pain.
I can't.
She's going to come in a few minutes and we'll figure something out for you.
You're too much.
Hi, Ms. Lee. How are you doing?
I'm alright.
You're doing okay?
Mm-hmm.
Are you in any pain?
A little bit more pain than before.
A lot more pain.
On a scale of 1 to 10, how would you rate your pain?
Like a 7?
A 7?
Yeah.
Is the pain still in your shoulder?
It's kind of radiating towards my neck a little bit now.
Only towards your neck?
Kind of.
Okay.
Yeah, but you said before your body was aching too. It's not just your neck.
I mean, listen, she gave me something earlier, okay? I don't want to keep pushing her to give me something I don't want to take.
Ms. Lee, we're here to help you. So if you're in pain, you can let us know and I can ask the nurse practitioner to prescribe something for you.
Well, I don't know, I just feel bad, you know, I have to take all these pills. I'm not used to taking so many drugs and stuff.
I understand. But
Let's just see what the nurse practitioner says. There's a second opinion, you know.
Okay.
yeah. So the ibuprofen didn't work, so I'm gonna ask the nurse practitioner if there's anything else that we can prescribe you so that you feel better.
Okay.
Is there anything else that I could do for you?
I'm fine, thank you.
Okay, I'll be back in soon to tell you what we're gonna prescribe for you from the nurse practitioner.
Okay.
Thank you.
Hey Tori, what's up?
Hey, how's it going?
It's going good.
How was your weekend?
It was good. I went out a little bit. How was your weekend?
It wasn't bad. I can't complain.
That's good.
A break is a break.
Yeah.
So what's going on?
I'm treating this patient, Miss Lee.
Mhm.
She's 88 years old with bone cancer and she's obviously in pain.
Okay.
But she doesn't say that she's in pain. So at first I gave her 800 milligrams of the ibuprofen that you ordered.
Mhm.
And she's at that point her pain was a 3 on a scale of 10.
Okay.
So now I went in and her pain is at a 7 out of 10, but the daughter kind of seems that she's not being honest with us, that she's kind of withholding her pain because of their culture.
Okay.
She said to me that she's supposed to deal with the pain, that it's just the way that it's supposed to be, and she kind of doesn't want us to help her. She thinks that she's a burden. So I said I would come and talk to you to see if there's anything that we could give her.
Okay. Well, I understand. Well, you know, bone cancer can be extremely painful. So,
Yeah.
did she say if her pain was like localized or any area throughout her body?
She said at first when I gave the ibuprofen that it was just in her shoulder, but now she's saying that it's radiating up to her neck.
Okay.
When I went into the room, I observed that she was clutching her fists together and she
Mhm.
seemed like she was in more pain.
Okay.
So I just wanted to know if there was anything else that I could give her.
Yeah, I mean, since she's in extreme pain, you know, I can prescribe morphine to help. Also, let me check the patient's chart to see if there's any contraindications. Oh, I see she's of Asian descent. Okay. So since Miss Lee had, she does not have a medical history of asthma, COPD, or any respiratory complications, you know, she doesn't have a substance abuse past or any seizure disorders or any renal or hepatic disease. And she's not taking warfarin, she's not on TCAs or any antihistamines, so she'll be fine on morphine. So since Miss Lee's 88, she's also of an age, so I'm gonna prescribe a lower IV dose along with her Asian descent past history, so just for the risk of respiratory depression, you know. So I'm gonna prescribe her around 4 milligrams of IM.
Okay.
I'll probably change that though in the semi-MR as I go along, just to see how she's doing. If she
Okay.
doesn't feel okay with within like an hour or so with the 4, then come back to me and then I'll up
Okay.
the dose. But as we know, Asians metabolize those drugs
slower.
faster and slower, so I can always increase it. So just come back to me if you ever need anything.
Okay. And I'll ask Teresa to come and do the medication with me since morphine is an opioid and you need 2 nurses to check.
Right. Okay.
Okay, sounds good.
All right.
Hey Teresa, could you help me out for a second? Sure. I have a patient that's going to be receiving morphine and I wanted to know if you could just be here to witness me taking it out of the med cart.
Okay, no problem.
Okay.
What medication are you giving?
It's morphine. So we'll just read here that it says morphine sulfate and it's 100 units per milliliter.
Expiration date August 2022.
Okay. Thanks, Teresa. Now, do you mind? I'm going to go into the patient's room and draw it up. Do you mind coming with me so that you can see me empty the vial once it's done? Thanks. Hi, Miss Lee. How are you doing?
I'm alright.
This is my assistant nurse. nurse, Teresa.
Hi, how are you doing today?
I'm okay. So I was able to get the nurse practitioner to order something for your pain. Okay. So we're going to be giving you morphine IM 4 milligrams.
Okay.
So first we're going to take a set of vitals and see how you're doing so that we can make sure that you're okay to take the medication.
Alright.
Is there any side effects of this medication?
So there are some side effects. You might feel where you're a little sleepy because it does cause sedation. You might feel dizzy or have a headache. So we're going to check her blood pressure since it does cause sedation just to make sure that it's not too low.
Okay.
Her blood pressure is 130 over 95.
Okay.
Is that good?
It's a little high, but it's okay since she's in pain.
Okay.
Okay, I'm responsible for O2. Pardon my thoughts.
The morphine might also cause her to be confused, so we're going to be coming in every 15 minutes after I administer just to take vital signs and see how she's doing.
Okay.
O2 is 99 and the respirations is 20.
Now you said that it might cause respiratory depression.
Yes.
So what happens if like that happens?
If that
What do you do?
happens, well, since we're going to be coming in every 15 minutes, we're going to be looking for signs of that, and if that happens, I'll notify the healthcare provider immediately.
Okay.
It is a severe adverse effect, so it doesn't happen a lot, but we still want to monitor it.
Okay.
Okay. So now we're going to administer the morphine. So first we'll check again, morphine, and we have the correct needle syringe here. Now let me make sure that I put on gloves before I open it.
And it's not expired.
So I have opened the MAR. And I'm going to scan the morphine. Teresa, do you mind scanning the patient's bracelet?
What's your name and date of birth?
Garza. Birthday is December 30. I mean October 31st, 1930.
Yep, that's it.
Okay, so everything's logged in. Now I'm going to administer morphine. Okay. Scoop and I'll place it back in place. Okay. So I'm just going to administer it in your arm. Teresa, do you mind passing me an alcohol swab?
No problem.
Thank you. And we'll just clean the skin. And let it air dry.
If anything happens at you have respiratory depression, we have the antidote.
What's the antidote
Good
for
to
it?
know.
Narcan. It'll just bounce everything back into spot.
Okay.
Okay. Okay. seal cap on and disposing.
Hopefully that'll make you feel better.
Okay, now we're just gonna discard the rest of the morphine and log it in. Okay, so this is, the vial is now empty, and now we'll put it into the MAR. And just write your name that we both discarded the morphine. Okay. Is there anything else that we can do for you today, Miss Lee?
No, that's it. I'm fine.
Okay, we'll be back in 15 minutes to check your vital signs and see how you're doing.
Alright.